My name is Donna Stern, and I'm a medical oncologist. I work at St. Mary's Hospital in the Department of Medicine/Oncology. My major role is clinical care, but we do participate in clinical trials as well, which is doing clinical research. So basically, we see patients, we do consultations. We are probably the first line after the surgery, and as a team of oncologists, we decide on the clinical care of the patient, whether the patient should have chemotherapy and or radiation and or endocrine or hormonal therapy. But it's important to emphasize that I'm part of a team, not only a team of oncologists, but we have nurses, we have nurse clinicians, we have psychologists, we have music therapists, and as a team, we take care of the patient. So breast cancer is different from other cancers because breasts are associated with femininity and wholeness of women. So it's always different than other cancers. It's the commonest cancer amongst women, first of all. And it's always shocking when a patient is told she has breast cancer. But first of all, breast cancer is not one disease. It's many different types of disease. So it can be more aggressive, it can be less aggressive. And so each cancer is unique, and the approach to each cancer has to be unique and individualized. Well, the two main ways that in which patients present is one, a woman will go for a routine mammogram and will be called back and will be told that there's something abnormal. And then she will be told to see a surgeon. The surgeon will do a biopsy and proceed with surgery. And that's happening more often because of screening mammograms. Mm-hmm. And then the other common way is a patient will feel an abnormality on the breast. And it could be a lump, it could be a nipple discharge, it could be a change in skin color. And she will go to her doctor, and then we'll have a mammogram, biopsy, and proceed the same way. So those are the two common ways. Yeah. In an ideal world, we want things to happen right away, but it's not an ideal world, and every health system has its wait times, and it's frustrating, but there's no way around it. So, a woman has her lump, she has to see her doctor, and then she has to be referred to another doctor, or she has to have a mammogram, and then the doctor has to do a biopsy. It has to be confirmed because not all lumps are malignant. And then if she has cancer, the surgeon has to schedule the biopsy. And then, has to schedule the surgery. And then you have to wait for the results of the surgery to come back because the type of treatment you receive will depend on the surgical findings. And then you need to see the medical oncologist, sometimes the radiotherapist. All these things require wait times, and there are guidelines in Canada for the wait times. And it's frustrating that you have to wait, but there's no way around it. Now, if you feel you're waiting beyond what the guidelines are, then that's important, and then you should complain. But there's no way around it. And as for the anxiety, I wish I knew how to advise people on